The uses of Icy Hot Pain Relieving 2.5% Topical Gel Dermatological Irritants-Counter-Irritant formulations may vary depending on the brand. Some brands are used to treat minor aches and pains of the muscles and joints, like arthritis, backache, and sprains. While other brands are used to help relieve itching and skin irritation, such as due to sunburn, insect bites, or minor scrapes. The active ingredient, menthol, acts as a counter-irritant, causing the skin to feel cool and then warm. It is recommended to apply a thin layer of the gel to the affected area no more than 3 to 4 times daily, and it's best to use it at the first sign of pain or discomfort. When using Icy Hot Pain Relieving 2.5% Topical Gel, make sure to carefully read and follow all directions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. This medication is meant to be used on the skin only. Apply it to the affected area no more than 3 to 4 times a day. If you are using the cream, gel, or liquid, rub it in gently and thoroughly. Some liquid forms of this medication should be shaken before use. Let the medicine dry completely before allowing anyone else to touch the area. After applying the medication, make sure to wash your hands well, unless you are using it to treat your hands. Avoid getting this medication in your eyes, nose, or mouth. If you do, flush with plenty of water. Do not apply this medication to serious burns or deep wounds, and do not tightly wrap the affected area. Also, avoid using a sunlamp/tanning bed, hot water bottle, or heating pad/device on the treated area. Check the ingredients on the label, even if you have used the product before. The manufacturer may have changed the ingredients. Also, products with similar names may contain different ingredients meant for different purposes. Read the label carefully to make sure you have the right product for you. If your condition lasts for more than 7 days, gets worse, or keeps returning, consult your doctor. If you think you may have a serious medical problem, seek medical help right away. If you experience redness, warmth, or irritation at the application site, it is important to let your doctor or pharmacist know. Your doctor has determined that the benefits of using this medication outweigh the potential side effects. Most people do not experience serious side effects while using this medication. However, if you notice blistering, swelling, or increased pain at the application site, stop using the medication and contact your doctor immediately. In rare cases, a serious allergic reaction may occur, so seek medical help if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. It is important to note that this is not a complete list of possible side effects, so if you notice any other effects, it's best to contact your doctor or pharmacist. In the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Icy Hot Pain Relieving 2.5% Topical Gel, make sure to let your doctor or pharmacist know if you are allergic to menthol or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. Also, be sure to inform your doctor or pharmacist about your medical history before using this medication. If you are planning to have surgery, let your doctor or dentist know about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, only use this medication when clearly needed and discuss the risks and benefits with your doctor. It is unclear whether this medication passes into breast milk, so it's important to consult your doctor before breastfeeding. When using Icy Hot Pain Relieving 2.5% Topical Gel, it's important to be aware of any potential drug interactions that could affect how your medications work or increase the risk of serious side effects. Be sure to keep a list of all the products you use, including both prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without first obtaining approval from your doctor. This will help ensure the safe and effective use of Icy Hot Pain Relieving 2.5% Topical Gel. If this medicine is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the US, you can contact your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center for assistance. Make sure to use Icy Hot Pain Relieving 2.5% Topical Gel as directed by your doctor or as indicated on the package. It is important to follow the instructions carefully to ensure you are using the correct amount and applying it at the right time. This gel can be used to relieve pain from muscle strains, arthritis, and other similar conditions. Apply a thin layer of the gel to the affected area and gently rub it in. Wash your hands thoroughly after applying the gel to avoid getting it in your eyes or on sensitive areas of your skin. Use this medication regularly to get the most benefit from it. If you have any questions about how to use Icy Hot Pain Relieving 2.5% Topical Gel, consult your doctor or pharmacist. If you are using this product regularly and forget to use it, apply it as soon as you remember. If it is close to the time for your next dose, skip the missed dose and continue with your regular dosing schedule. Do not use a double dose to make up for the missed one. When storing this medication, make sure to keep it at room temperature. It's important to check the product package for specific storage instructions, as different brands may have different requirements. Always keep medications out of reach of children and pets. When it comes to getting rid of this product, don't flush it down the toilet or pour it down the drain unless directed to do so. Instead, properly discard it when it's expired or you no longer need it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.